Now you can start, sir.
Okay, so here I start with my first case, a very common condition. A 15-year-old male having came with a complaint of well-defined silvery white scaly patches all over the body. Almost 75% of the body is involved. The condition is very easy to diagnose. It's a case of psoriasis vulgaris, right? It's a case of psoriasis vulgaris. We know this is a very chronic condition, although it is a non-infectious, but it creates a lot of psychological problem. The child will find it very difficult to go to the school and play with other kids. So this is what the treatment, like a newer treatment, like a cyclosporine we have given to the patient, and there is a good resolution in the psoriasis patches. The another view of the same psoriasis, frontal view. So what is a guideline for management of psoriasis? We have a earlier treatment like methotrexate and a coal tar and a PUA therapy. But nowadays many newer therapies are there like acetatin, cyclosporine and biologics, which has changed the outcome of a psoriasis condition. Here the two injection of the biologics will give you the remission for many years also. So this kind of newer modalities has changed the outcome of the psoriasis. This patient was given a cyclosporine 2.5 to 5 milligram per kg body weight is given like it's. I will straightway move to the next case. The case is of Steven-Johnson syndrome. Earlier, this kind of cases we used to treat with a immunoglobulin and a lot of high dose of steroid. But nowadays, if we prefer cyclosporine drug here, there is a very rapid resolution in the patches. You can see the very rapid resolution more than a week time it takes. So role of cyclosporine is like it faster recovery, rapid reepithelialization. It reduces the hospital stay, also reduces the mortality and morbidity. You can see the kid having a faster resolution and a faster reepithelialization. So case of Steven-Johnson syndrome, we no longer use the steroid here and we prefer cyclosporine as the newer drug option. My third case is again a female with around like 33 year of age having a crusted lesion on the face, scalp, all over the body. She is a widow. She was not able to do the work because of this lesion, and her condition was diagnosed after the histopathology as a pemphigus foliaceus. Earlier, the treatment for pemphigus was a steroid, and we know the side effect of steroid when given in a very high dose, which is required for the pemphigus. It gives rise to a lot of side effect like bone marrow, weakening of the bones, Cushingite syndrome, hypertension, diabetes, acid peptic disease. But now with this newer drug like rituximab, which is a biologics, which is to be given in a two doses on day 1 and day 15, we can see the very nice resolution of the lesions and the patient is off the treatment since last 3 years. So this is a rituximab, which is nothing but a biologics, which we use for the pemphigus now. So the treatment has changed of pemphigus from steroids and immunoglobulins to the biologics. Here we are having a better result and lesser side effects. Another case of a pemphigus before and after, another case of pemphigus before and after. Next case is a fungal infection. The case I have chosen this here is because nowadays, earlier we used to get a fungal infection restricted to the groin area. But nowadays what we are getting the fungal infection. So the kind of fungal infection which we are getting is even after the treatment, they are not responding. That is called recalcitrant. They are becoming chronic, means they are taking more than 6 month duration. And even after the treatment, what we are getting is a recurrence back. So what has changed here? They are difficult to treat. They are involving the wider area of the body. They are not classical. They are ill-defined. Facial involvement was not common earlier, which is very common nowadays. Pediatric population used to get involvement of the fungus very less, but now it is very common. The duration of treatment used to be of 3 to 4 weeks. Nowadays it is more than 3 months. So this is what the things are changing. And the which are the drug which are available, like all the drugs after giving the recommended doses, patient keep getting the recurrence. The duration of the treatment has increased and the doses are almost double of all the antifungal. So the point to be noted here, the common condition, it is very difficult to be treated. Please avoid treating this patient with a low dose of antifungal and avoid using the steroid cream along with it, and treatment of all the family member is very important. My next case is again a common condition which we face nowadays is a people coming with lot of side effects of steroid cream which has been applied on the face, and this steroid cream they applied for the fairness purpose. This has been advised to them by either parlor or chemist or by some family physician for some pigmentation, for pimples, and for some spots. But after initial improvement, what they start getting is a lot of disfiguring of the face, lot of pustular acne lesions. So the aim of presenting this, including this case, was to educate all the people. Like it's even if there is a some condition where we need to use a steroid on the face, we should be very careful that the steroid potency should be very mild, even if we are using it, and we should try to avoid steroid combination antifungal cream on the face. The common side effect which we get is atrophy, erythema, telangiectasia, purpura, and lot of side effect. Here we can see like it, the skin looks very aging, telangiectasia all over the face. You can see the thinning of the skin and increase in the hair growth. You can see the before and after photograph after the treatment once the patient is improved. So the message is to avoid the steroid misuse. And the next case is like a hair fall case. What we do nowadays, apart from the traditional minoxidil therapy and finasteride, there are a lot many good options we have nowadays. You can see the result here in this case, like it. This is over a period of like 4 to 5 months. This what we do is a platelet-rich plasma therapy, which we use for the hair growth therapy. So what why platelet is been given? Because platelet has a lot of granules, alpha granules, which contain a lot of growth factor, which when we give to the area where we are giving it the, suppose we are giving it to the scalp, areas which are going through the like a catagen phase get converted into the anagen phase and the growth start again. So it's a very simple procedure. We also use this for the wound healing purpose. The non-healing ulcer, when we put PRP over this or platelet over this, the ulcer which is not getting healed since many months get very much faster resolution in a few weeks time. So it's another utility of the platelet-rich plasma therapy and a platelet-rich fabric. So another treatment modality for the hair growth is a eye growth therapy, or you can say laser light therapy for the hair loss. You can see these patients like it having a thinning of hair, they gradually started improving the density. And this is what we use the hair growth, which is nothing but a diode laser for the growth of the hairs. So this is also known as the red light therapy and cold laser therapy. It's a non-invasive, painless, without any side effect, and it's irritate the photon into the scalp tissue and which absorbed by the weak cell, and that in turn give rise to the encouragement of the hair growth. My next case is about the acne. The traditional treatment for acne was erythromycin and clindamycin as a erythromycin in a topical form. But nowadays, our like a main treatment line may we prefer antibiotics. In fact, most of the cases we don't need any antibiotics. The better drug is isotretinoin. We have like it, we act on the all the controlling the sebum, act as antibacterials, and it's a wonderful drug which has changed the treatment the way we used to do the treatment earlier. And laser added to the more better and a faster resolution, faster outcome we get, lesser antibiotic required, so there is a less chances of antibiotic resistance because azithromycin is the commonly used drug which is again required for typical mycobacterial infection and many respiratory infection. So we try to avoid those kind of things. This is the laser modality is done for the acne, and this laser has help in a rapid resolution, and the scarring can be corrected with this lasers. Another case is about her alopecia areata. This female came with this. Since last 5 years, she is of having a hair loss, and you can see the good regrowth of the hair. So earlier, what we used to give is the intralesional steroid hairs and like immunosuppressive drug like azathioprine and a methotrexate and apremilast. But nowadays, what we have is a tofacitinib, which is a JAK inhibitor. Although it has been approved for rheumatoid arthritis, but like it has been found to be a very good in a alopecia areata and vitiligo also. The next case is a case of a herpes zoster with a lot of scarring and a hyperpigmentation. You can see the very nice resolution over here. Almost pigment is gone and the scarring is also minimized. Next case is a scarring on the forehead. Another case is a scarring on the nose, resolving almost equally. So this is a laser which has been used for the scar. Here the burn case which is almost resolved after the single session of the laser. The dermal nevus resolve. So this is about the newer treatment option we have, like a fractional CO2 laser, which is a wonderful modality nowadays in our like ornaments. Like it, we can treat a lot of scarring with this stretch marks. It is used for the anti-aging and cosmetic purpose as well. And my last, not the last, the next case is a case of a vitiligo, very classically diagnosed milky white patches on the face. The previous treatment used to be like a PUVA therapy, where we have to give a surrealin and expose the patient to the sunlight. But now with the help of like a targeted phototherapy and exam and laser, the same thing like it we have the results has become very nice enough. We can get in a few months time a rapid repigmentation in case of a vitiligo, as is seen in this case. Like here, this is how the targeted phototherapy we give. The same treatment is also used in a chronic eczema and psoriasis, the lesion which otherwise we find it very difficult. They keep going for years and years, which can be resolved with this eczema or targeted laser. You can see the response in a 5 months time. My last case is a case of a young female having a pigmentation on the face. You can see the both the side of the face there is a good amount of hyperpigmentation and a thickening of the skin. The treatment which we have done, and this is what the result with this, and this is for what we use for this is like a Q switch laser, Q switch ND-arc laser, along with some multivitamin supplements and sun protective creams. And this is a very useful very useful tool used for the all kind of hyperpigmentation like birth nevus, melasma, freckles. And very popularly we use it for the laser facial during the marriages, and it is also been used for the tattoo removals. I think the time permitted me and I was able to finish it with the times. So thank you.